All right, let's chat PCOS today. In this video, I'm going to share symptoms, treatments, all about PCOS because it's such a misunderstood diagnosis as well. So stay till the end to learn the ins and outs of PCOS. If you haven't hit the subscribe button yet, hit that button to be notified anytime I post new content related to women's health, hormones, or holistic health. PCOS, also known as polycystic ovarian syndrome. This is such a complex diagnosis, and so many women, like endometriosis, which I did a video on that last week, is so misunderstood and so misdiagnosed. There's a lot of women who have a lot of other diagnoses like hyperlactin or hypothalamic amenorrhea, and that's the diagnosis versus PCOS, and the treatment's way different. So I'm going to share with you first what PCOS is and how to get the correct diagnosis for it. PCOS, polycystic ovarian syndrome, affects up to about 10% of women, which is a decent amount. And basically, it's super misunderstood. The sort of like the idea of PCOS is that it's just for overweight women and it has to do with metabolic stuff, and like women who have a normal body weight don't ever need to worry about it. And I couldn't tell you how much more false this could be. I've seen it play out over and over and over clinically in my practice over the last 12 years. And literally that sort of like mythology and ideation around PCOS couldn't be more off. PCOS is best defined as literally just a group of symptoms. And it's defined by basically a lack of ovulation, so anovulation, meaning that a woman is not ovulating during her period, and symptoms or high levels of androgens, which are male hormones. So those are the two criteria that have to be present to diagnose PCOS. In addition to that, there's 4 different types of PCOS, which we'll go into, and it can present in a myriad of different ways with different symptoms looking really, really different from woman to woman. Like I mentioned, PCOS in a nutshell is just generally a problem with not ovulating and having a high production of androgens, which is like testosterone, androsterone, DHEA, sulfate. Those are male hormones. And so again, that can present in a numerous different ways, but that is basically what we're looking at. This is why the diagnosis, it sounds simple, you guys, but this is why the diagnosis can be hard, because a lot of people are looking for PCOS diagnosis just based on the fact that a woman might be overweight and not having a period, or looking at an ultrasound and showing that there's cysts, which is not ideal. It's not evidence-based to diagnose PCOS based on an ultrasound. It can be part of the diagnosis if that's there, but it's definitely not the only thing to look at, and PCOS cannot solely be diagnosed based on an ultrasound. So if you've had a practitioner that's just ruled it out and said, yeah, you have PCOS without any type of blood testing, that's definitely a red flag, or diagnosed you with PCOS just solely based on an ultrasound, that's also a bit of a red flag. Unfortunately, there is no definitive one test that says, yes, this woman has PCOS, because like I said, it's a group of symptoms. The Androgen Excess and PCOS Society came up with criteria that I'm gonna read to you guys about what it needs to be to diagnose PCOS. So the AE-PCOS Society says that a woman has PCOS if she has irregular periods or polycystic ovaries on an ultrasound, high androgens or symptoms of high androgens such as acne or hair loss, or other reasons for high androgens have been ruled out. There are other things like certain birth controls with high androgen indexes, certain psychiatric drugs like SSRIs, high prolactin levels, hypothyroidism, some congenital adrenal hyperplasia. Those are also reasons to have some of these diagnoses. And so you'd want to rule all of those out as well through blood tests. So making sure that you're getting, looking at your birth control, looking at your psychiatric medications, looking at your thyroid, looking at your prolactin level. Those would all be important in the ruling out of other conditions to actually lead you to the diagnosis of PCOS. You also can look at things like your follicle stimulating hormone, your AMH or anti-Mullerian hormone, your luteinizing hormone, your estrogen. Like I said, you'd want to look at your androgen profile, so your testosterone and your DHEA. All of these things together, including an ultrasound, would give you the diagnosis of PCOS. So if you haven't had all of that done and you've been diagnosed with that, it's time maybe to find a new practitioner or push your current one to actually do some of that stuff so that you can have an accurate diagnosis. Conventional treatment of PCOS are things like very symptom management. So it just kind of depends on what symptoms women are showing up with, but it can be things like birth control to just regulate the cycle, and I say regulate in air quotes because it doesn't regulate the cycle. Birth control actually just shuts off your own hormones, and so your brain is no longer communicating with your ovaries, but you're getting a steady state of synthetic hormones in, and that feels more controllable to a lot of practitioners and even women. The second thing for like high insulin, which is another huge component of PCOS and like the metabolic damage of it, a lot of women will use metformin or Victoza, which is helpful for lowering your A1C, lowering your blood sugar. You also can use things like spironolactone, which is a diuretic, but also has an off-label use of being an androgen blocker. So for a lot of women with like hair loss or facial hair growth or chin and jawline acne, spironolactone is commonly prescribed. And honestly, you guys, that's kind of what the treatment is. If you want to get pregnant with PCOS, a lot of practitioners will recommend doing IUIs and probably IVF for that. But like I said, there has been so much research on PCOS, and there's so many things to do to get this handled at kind of a natural level so that a woman is not just going from birth control to suppress hormones to then wanting to get pregnant and then going through the IVF cycle. I think it's important to get your insulin in a good place, your adrenal glands in a good place, focus on getting your androgens in a good place. There's so many things we can do for this that, in my opinion, just using some of those other medications is sort of like putting a Band-Aid on kind of what's already there. Again, because PCOS is just a group of symptoms, it really can show up in so many different ways. It can show up as period problems, whether that's heavy period, irregular periods, no periods, anovulatory cycles. It can show up as weight gain or stubborn weight loss. It can show up as like blood sugar dysregulation and insulin resistance. It can show up as, like I mentioned, like facial hair growth or jaw and chin acne. It can show up as like hairline hair loss. So usually with PCOS or high androgen hair loss, usually like the part of your hair is kind of like whitening right here, or you're noticing like this receding hairline. It's usually like male pattern baldness that you're seeing with high androgens, not necessarily just like thinning of your hair overall. That's typically not what this looks like. Those are kind of like the different symptoms that women would notice. And like I said, it's just a collection of different things that kind of go together to create this diagnosis. So next I want to talk about the 4 types of PCOS. So once you kind of get the diagnosis of like, yep, my cycles are anovulatory and I have a high androgen index, you would want to look at what else is going on. The most common driver of PCOS by far is insulin resistance. And that doesn't mean just overweight women have this. There's a lot of women with a normal body weight that also have insulin resistance. So solely just looking at a woman's BMI is not a good indicator of PCOS. So I want to just check that sort of notion at the door, because that's what a lot of people think. So insulin resistance is a common driver of that. So we'd want to look at your hemoglobin A1C, your fasting blood glucose, your insulin levels, and make sure that your metabolic state is in a good place. If it's not, and you are having that, that's probably the type of PCOS that you have, which is more, like I mentioned, insulin resistance PCOS. The second PCOS that we have quite commonly is post-pill PCOS. So these are women who have been on the birth control pill for a while, and they come off the pill and start to notice that they're getting these high androgen symptoms and anovulatory cycles. This is likely due from just coming off of the pill and likely resolves within a few months. So post-pill PCOS can definitely be treated. I help women kind of come off the pill and sort of re-iron out their endocrine system and their sex hormones all the time, with helping just kind of reestablish ovulation, that brain to ovary connection, things like that. But post-pill PCOS can definitely be a thing. A lot of women might notice like coming off the pill and noticing a lot of like jaw or chin acne, and that's because the birth control pill actually suppresses a lot of the sebum in your skin, and so your body's sort of in overdrive producing that sebum. And so when you no longer have the birth control pill to block that sebum, acne can definitely be prevalent in the first little while after you get off the pill. So if you have these symptoms and you've just gotten off the birth control pill, chances are it probably will resolve. There's practitioners like myself that can help you kind of get through that, but that's probably the diagnosis is more like post-pill PCOS. The third type of PCOS is inflammatory PCOS. So basically this is sort of like a ruling out or exclusion of symptoms. We haven't gotten off the birth control recently. We don't have insulin resistance, but we have anovulation and we have high androgens, but we also might have like headaches or bloating or joint pain, water retention, fatigue. We have other signs of inflammation going on. That kind of leads us to more of the inflammatory fatigue. And then lastly is the adrenal fatigue. And this all came from Dr. Laura Brydon's book, The Period Repair Manual. I love her stuff so much, and she's been a huge mentor to me in my own practice for several years. I read all of her stuff in her books and do CEU courses and things like that. So this is where this information came from, and I find it's extremely applicable in clinical practice as well. Adrenal PCOS would be more, again, a further exclusion, so not insulin resistant, not post-pill, not inflammatory, but maybe having a lot of stress in our life, having gone through traumatic situations, having a lot of fatigue, insomnia, having more adrenal fatigue or an HPA axis dysfunction symptoms, as well as high androgens and ovulation. Okay, so the treatment of PCOS and some natural things that I do is sort of like first to identify which type of PCOS, and that will help us to identify what we need to do. Do we need to really work on anti-inflammation? Do we need to really work on reestablishing the brain to ovary connection after the birth control pill? Do we really need to work on metabolic health with insulin resistance? Or do we really need to work on the stress response with the adrenal type of PCOS? That's sort of the first step, is to notice which type of PCOS we're really working on so that we can really start to tailor the treatment that way. The first thing that I generally recommend for all 4 types, and this is really for all hormonal issues, is to work on your nutrition. Nutrition's a huge part of this, and for all hormonal stuff, I think about it in terms of a hormone pyramid. The very bottom layer of a hormone pyramid is going to be insulin, adrenaline, and cortisol. Those 3 things have to be in a good place for everything sort of up the chain, like androgens or testosterone, DHEA, estrogen, progesterone, melatonin, leptin, ghrelin, to kind of get those things in the right place. So I always start with like, let's make sure that our insulin's super balanced and that we're eating for hormonal health. So eating for hormonal health looks like filling your plate most of the time with a protein, fat, and fiber. We always want to try to aim for, 30-ish grams of protein per meal, about 1 to 2 tablespoons of a healthy fat, and about 10 grams of fiber. That's a really, really solid balanced meal to keep your body healthy, your stress response down, your blood sugar balanced, and your body feeling good in terms of hunger, energy, cravings, mood, and sleep. So I start there, and then I also want women to focus on getting as many micronutrients from their food as possible. So the variety of fruits and vegetables, all the different colors, from berries to citrus to greens to root vegetables, all of those different things have different nutrient profiles in them and have amazing vitamins and minerals in all of them. So vitamins and minerals, remember, are like the spark plugs of our body and fuel all metabolic processes. A lot of people believe that if you have hormonal imbalances, you actually have mineral imbalances as well, which is where we want to start with eating really whole food nutrition, really good quality foods. Also making sure that you're getting in good quality animal proteins like fish, chicken, beef, pork. Those also are going to have amino acids and zinc and B vitamins and selenium and all of that great stuff in there as well. Number 2 is exercise. And exercise, you guys, is very subjective. Obviously, if we have an adrenal type of PCOS, we don't necessarily want to be doing like intense HIIT workouts all the time because we're already struggling with our stress response. I think the best kind of hormonally healthy way to exercise is to do strength training. Strength training is going to help to regulate our testosterone level. It's going to help to produce human growth hormone, produce antioxidants. It's going to be really great for not really elevating cortisol for way longer than it needs to, like a long distance run or a lot of HIIT, things like that. Building muscle makes us metabolically healthier. It helps to reduce insulin sensitivity the more muscle mass we have. So building muscle can do nothing but good things for women. So I think that strength training a few days a week, from 2 to 4 days a week, is a really great start. And then secondly, I think walking, doing leisure walking is just the best. It's super underestimated. A lot of people think that it's not a big enough workout, and if they're gonna do it, they might as well like do these big HIIT workouts and things like that. But just simply walking is great for every single type of PCOS, and honestly, all types of hormonal imbalances. And to go further than that, just your health in general. Walking really does do everything for us. So if you can get out and do around 10,000 steps a day, if you need less than that, that's fine. But any amount of walking is going to be better than none. So those are kind of like the first type that I recommend. If you want to do some yoga, that obviously is going to be some weight bearing exercise as well through body weight. I think yoga is great for obviously the stress response, but strengthening muscles and things like that too. So I think as long as you're moving your body in some way and not burning it out through massive amounts of HIIT workouts and long distance running and things like that, I think hormonally you'll probably be in a good place. In terms of supplements, again, we gotta remember what type of PCOS we have. So is it insulin resistant, post-pill, adrenal, or inflammation or inflammatory PCOS? That is going to be really helpful in figuring out which supplements are going to work the best for you. So there's not like a one size fits all protocol for PCOS because all of these different factors matter. In general though, there are a few things that I really like to use. Beef liver capsules, I say this in almost every single video, you guys. Beef liver capsules are just great for B vitamins, vitamins A, D, E, and K. Zinc is in there, has a bunch of great micronutrients that I talk about all the time and their benefits. Can be super, super helpful at just remineralizing your body and kind of supporting it in just a foundational way. So I like taking beef liver a lot for most people. Again, not medical advice. Please work with a practitioner to make sure that all of these recommendations work for you. But beef liver is great. The second thing that I recommend for most people is getting in some supplementation with magnesium. Magnesium is hard to get through foods, just through our depleted soils and things like that. Stress also depletes magnesium fast, so that can be mental, emotional, or physical stress. So magnesium can be hard to get for us, and we need a high amount of it. So I recommend on a simple level, like Epsom salt foot soaks or baths. You can do ancient minerals, lotions, or sprays, or you can take it internally through like a magnesium glycinate or a magnesium malate, which will cross the blood-brain barrier and go intracellular. Magnesium is like a miracle for all period problems. It helps your liver filter hormones better. It helps with your stress response. It helps sleep. It helps bowel movements, which will help reduce like endotoxins and extra estrogens. That's how we get those things out, is through our bowel movements. It helps with period pain and inflammation. Magnesium is really, really wonderful in so many different regards. It's needed for over 300 different reactions in the body. And so I recommend most women supplement with some form of magnesium. Studies have also shown that a high magnesium diet is also correlated with a lower risk of insulin resistance too. So again, does lots and lots of great things for us. You may have also heard of myo-inositol. Myo-inositol actually helps with our sensitivity to insulin. It restores ovulation, and it's wonderful for women with insulin-resistant PCOS. There's two forms of inositol. One of them is called myo-inositol. One of them is called D-chiro-inositol. The ratio for those should be a 40-to-1 ratio, so on your supplement, you want to make sure that that's actually happening. A great formula that I love for this is called Ovacitol. It's a company that makes a powder with the right ratio of myo to D-chiro-inositol, and it can be really, really helpful for women who are wanting to restore ovulation, help with insulin resistance, and even help aid fertility. So for a lot of my fertility patients who are struggling with PCOS, and have insulin resistance, this is a formula that I use quite often. Berberine has also performed very well in clinical trials for reducing insulin resistance in acne and even being anti-inflammatory. Berberine is a great supplement, but it can be really hard on the stomach sometimes for some people, much like a metformin. So if you have issues with berberine, you may want to start at a lower dose, or have a sensitive stomach, you may want to start at a lower dose, and just really be careful about your A1C and your blood sugar level, because it can really reduce that. Which is welcomed for some people, but for some people it's not. So again, you just want to make sure that you're always taking the right supplements, the right dosages, things like that. But berberine can also be really great for acne too. A lot of women have jaw or chin line hormonal acne with PCOS, in which berberine can be really helpful. Vitex or chastetree berry is really great for post-pill PCOS. Vitex helps to support progesterone levels, which is going to oppose your estrogen, and it also helps to reestablish that brain to ovary connection. So Vitex, especially for post-pill or the adrenal type of PCOS, can be really helpful. NAC is a product that's called N-acetylcysteine. It's an amino acid. It's really helpful for the inflammatory type of PCOS. So it can reduce inflammation, it can help restore ovulation, it can be helpful for anxiety. NAC is really helpful for liver function. So NAC is really helpful, but you just want to make sure that you're taking the right dosage of it, which is about 500 to 2,000 milligrams per day. And then lastly, for supplements, I like to use DIM, which is a constituent in cruciferous vegetables like broccoli and cauliflower, for like really heavy periods, or more like the estrogen dominant symptoms. So a lot of PMS, a lot of heavy periods, things like that. Again, a lot of women with PCOS have really irregular periods or no period at all. So you always would want to do some testing to see what your estrogen level is, to make sure that it's actually, verified and needing DIM, and you would want it to be lowered. So again, very individualized diagnosis and a very individualized approach with PCOS is definitely needed. There is no one size fits all for this. You really want to work with somebody who understands PCOS, who understands which testing to do, all of those things, because it's super important. A Dutch test is a dried urine test that can be really great for PCOS. But like I said, to get the diagnosis, you'd also want to look at things like follicle stimulating hormone, luteinizing hormone, anti-Mullerian hormone, estrogen. You'd want to look at your androgen levels. All of these different things sort of all come together to compile the diagnosis. So work with somebody who knows what they're doing with PCOS. And like I said, you guys, there's so many different things that we can do to restore ovulation. If you're wondering if you can get pregnant, I think that these things are really, really great first steps for you. Acupuncture, I'm an acupuncturist. I love giving acupuncture to women with PCOS. And when I was in my practice, I thought it was wonderful for that too. So there's so much you can do. I just really can't reiterate that enough. If you're struggling with PCOS, please find somebody like myself who can help you with this. If you have friends and family who are struggling with PCOS, please share this video with them as well. Because we want to get this information out to as many women as possible, so they're not stuck just going on birth control or different things and just kind of masking the problem. If you haven't joined my free Facebook group, Holistic Health with Damron, I would love to see you over there. It's a wonderful group of women where you can ask questions and have good kind of communication about women's health, hormones, just the same things we talk about here on this channel. I hope you guys have a great rest of your day, and I'll see y'all soon.